She may look a very ordinary woman at first sight, but the neonatal unit at Mulago Hospital would probably not be there today if it wasn't for the extra effort that Dr Magaret Nakakeeto put in. Now a consultant pediatrician, Dr Nakakeeto embarked on devising means of saving neonates at Mulago Hospital over 10 years ago. By then, the number of preemies being admitted in the neonatal unit were outnumbering the incubators. Babies were sharing incubators and the number of babies dying was high.
When I came here, of course I found the things were even worse than when I had left in 1991. So somehow I thought that I had to make a difference.
With the help of friends from British Columbia in South America, Dr Nakakeeto assigned 2 of her medical staff to go to Bogota and study the kangaroo approach of incubating babies.
And we went to the stores and we got those beds you saw. We didn't have beds in here. In fact, when I went to ask for the beds in the store, they said, "Doctor, where are you taking adult beds in the special care unit?" I said, "I have something to do and start." And they wanted to give me old beds. I said, "No, I want new beds."
The method that requires mothers to place their preemies onto their chest so that a skin-to-skin touch is felt not only gives the babies extra warmth, but also keeps the heartbeat pace of the baby in unison with that of the mother, including bonding the two.
You know, those preterms, normally they forget to breathe, but it helps the baby to breathe. It helps the baby to put on weight, at least 20 grams per day if it is done well.
Dr Nakakeeto managed to inculcate this kangaroo method to many mothers who had lost hope after giving birth to babies with very low birth weights of as low as 800 grams.
She has the breathing problem, yeah, but when I put her here, it helps her, yeah, to maintain the breathing, yeah.
Other hospitals in the surrounding districts of Mayuge, Kayunga, Luwero, Iganga, Nakaseke and Nakasongola have so far started the mother care program.
I think last year, around November, when I went to Luwero, their book, they had like 30 babies who had gone through the kangaroo in their health unit. I was so proud because from 0 to 30 in a period of about 8 months. Then I said, where were they going? And they had lost about 2 babies.
At the moment, Dr Nakakeeto is working with different international agencies on a project to save preemies born in rural areas transferred safely to the nearest health units.
We have created a bag, and it has some kind of a gel which you can put in boiling water, and it can maintain a temperature of 37 for 2 hours. So you can transfer that baby for 2 hours. So we are saying if 2 hours elapse, you don't journey, have water in a flask, dip it again when it is wet and transfer it. You can use that one, you put it in as a mattress, put the baby on, and you can also put on skin to skin. So the baby is warm from this end and the other end.
The technology, which is now being taught in universities and different biomedical engineering schools around the country, will very soon be produced here. The senior pediatric consultant says bringing down child mortality rates from 26 to less than 10 in every 1,000 births is her greatest aspiration. Dr Nakakeeto says many babies die in the first 1 minute, termed by medics as the golden minute. She says this trend can be changed if deliveries were made safe to mothers. Dr Nakakeeto is now calling upon all medical practitioners to make their neonatal centers up to the required standards to avoid babies dying of preventable causes. The kangaroo method is widely used across the world. Isabel Nakiria, NTV.